NEET exam is easy. It's not a tough exam, but the problem is even if you qualify, you are not guaranteed a seat in your own country. If you want to pursue your dream of becoming a doctor and you are disheartened and you feel you don't want to waste years and years giving NEET, you should obviously explore this option. Hi, I'm Dr. Nashra Ansari and I'm from Navi Mumbai, Maharashtra. I just completed my MD degree from Lincoln American University, which is in Guyana, South America. And I recently cleared my June 2025 FMGE exam in the first attempt. So I had qualified my NEET exam in the first attempt as well, which was NEET 2018, but I could not get a government seat. So I was very disheartened at first. I had the option of going to MBBS abroad, but at that time it was not much common. And I was exploring my options as well, and I decided to take a drop. And I studied again for a year, gave my NEET 2019 exam as well, and I joined this institution. I got to know about Lincoln American University, and I started actually in 2019. And the curriculum is very unique, and the reason I chose this over other options or countries, you can say, was because the curriculum is US based. So we have first year pre-med, second and third year is MD program, which is preclinical, and the last is fourth and fifth year, which are the clinical rotations in a hospital. And Lincoln American University gave us option of different university countries to do our clinical rotations as well. We have an option of Guyana, the home country of the university. Then we had India as well, we had Nepal, we had US as well. So that intrigued me really. And I had options of giving, this would open my doors for giving USMLE. University is also accredited by the GMC, so I could have given PLAB as well. So this was a pretty good option for me, hence I chose this option. I started out in 2019 in Sharda University, which was pre-med. But then after 6 months, COVID hit, so we were forced to go homes. But still our online classes continued. We resumed back in 2021, I guess. That was our third year. I did my MD3 and MD4 from Guyana. And for clinical rotations, I chose India because of the institute, which was Max Institute. So I had heard a lot about our seniors who were doing clinical rotations in Max, that the experience is really good. So I preferred to go there. Some of my batchmates have also done in Guyana, and some of them chose for Nepal as well, and US as well. So my aim was primarily FMG, and then going for either USMLE or PLAB. I did from Max hospitals, and it was a really enriching experience. I had a great time around great faculties. The teaching was good, and most of the hospitals you don't get a lot of teaching and the clinical exposure, but with Max it was different. I got both of them. So the classes were really good, the administration was good, and the doctors were really nice and helped us a lot. So my clinical exposure after clinical rotations and my confidence went up. I was ready to confident enough to be a doctor at that point. Then we went back to Guyana to give our exit exams, and I cleared my exit exam in the first attempt again. And the exit exams, after that, I became very confident that FMGE is a piece of cake, because the exit exams were really hard and challenging. We not only had like MCQs, we had written exams, we had OSCEs, and for every subject. And we had to study a lot for that. After clearing my exit exam, which was in March 2025 this year, I had to give my FMG exam in July 2025, which was just few months of study. But I didn't really study much as I was exhausted because of my exit exams. I might have studied for a week or two, but I was confident enough that I will clear this exam, and I did clear it in the first attempt as well. And even I was shocked and surprised myself to see the results that I passed. And honestly, it was not that tough, and you have no negative marking like you have in NEET, so that's also a plus point. So now I will be going further with the process of counseling. state counseling. I collected my pass certificate yesterday. VC sir has really helped me throughout the journey, even with small, tiny stuff. Every little problem I had, or while I'm filling my form for anything, or any questions I had, he has the knowledge of everything. He can tell you, he can guide you very clearly on everything, and he will personally help you through your journey. So he has been a very good guiding light for my journey. And Abhijit sir, he is also really good in the administration, someone we can rely on. We can ask questions because VC sir is a very busy man. So sometimes if VC sir is busy, we can obviously reach out to Abhijit sir and he'll help us. NEET exam is easy. It's not a tough exam, but the problem is, even if you qualify, you are not guaranteed a seat in your own country, because there are pretty much very less seats, and going into a private college in India is expensive, and government colleges seats are very less. So even if you're qualified, you have that in you. I was very underconfident that I couldn't get a government seat. Maybe I don't belong to be a doctor. But then I realized that it's the opposite. It's because of the country and the amount of seats, it's very less. That's why I couldn't get in. Otherwise, options like these helped me a lot with my journey, and I am super confident now. If you want to pursue your dream of becoming a doctor and you are disheartened and you feel you don't want to waste years and years giving NEET, if you have the option to go abroad and explore, you should definitely do that. It's not less of an education. It is definitely hard work there as well as in India. But then you get the exposure, you meet people, you explore more options other than India as well. And you always have the option to come back to India by just clearing this FMGE exam. And it's not as tough as you think after you have done your MBBS abroad, because they are challenging as well. You should obviously explore this option. You can still become a doctor and come back to India, practice all over the world wherever you want to.